What's going on, everyone? Happy Wednesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, which I'm seeing a lot of people test positive on Twitter right now, if you did test positive, I hope you have a full and speedy recovery with no long-term issues. It is time now for the Wednesday edition of the Pandemic Update for Wednesday, January 24th, 2024. If you're new to my channel, this is where we do the daily pandemic update on not only just COVID, but a bunch of other viruses, and we do take a look at some other things as well. And today we're going to take a look at something that I promise you, we have not looked at in a long time. I just found out that there is a CDC section that I did not know existed, something that used to be on the HSS. So stay tuned for that. I think those of you who have been around for a while may know what I'm hinting at when I say the word HHS. So if you like this type of content, give it a thumbs up and subscribe to my channel down below. I promise to help keep you safe. All right, let's get started. We don't have a lot of news today. I didn't have enough time to really do any research, though I don't think I'm missing much. So if we find anything else, we'll get into tomorrow's update. That's all. COVID in pregnancy triples babies' odds for respiratory illness. We've seen this before. If you are pregnant, you want to take extra precautions and try and not get COVID. Remember, when you catch a case of COVID while pregnant, you also have a child inside of you. That child could likely, gain health problems because you are sick. I see so many people go out and about while they're pregnant, not wearing one of these lovely masks, which are effective, and just take risk. And then they wonder, oh, why did my child become born with such and such illness or whatnot? It's because you're taking risks, not just with COVID. Anytime you catch a virus of any sort while pregnant, it's not only risky for you, but it is risky for the child as well. So please, take precautions if you are a pregnant mother-to-be and you're going to go out and about. Please, mask up, because you're not just only protecting yourself, you're protecting the child as well. All right, let's take a look at a state we haven't taken a look at in a while, and that is Michigan. Michigan, COVID tracker, average daily cases fall 24%. Deaths are also dropping as well, and this report is as of yesterday, January 23rd at 4:02 p.m. Confirmed COVID-19 cases dropped 24% to an average of 523 per day from where they were at 684 the week before. The Michigan Public Health reported. The state also reported 82 confirmed COVID-19 deaths, down nearly 50% from 126 the previous week. And it does say here, of the 51 deaths occurred in December, bringing that month's total to 279. This is in 2023. Back in 2022, they had 621. So, that is year over year for December. That is an improvement for the month of December, but obviously there is still work to be done. And these numbers, hopefully they will continue to drop. All right, moving on now. Take a look at this. I tweeted this yesterday. I don't like to do trash talking or anything. I'm not a fan of trash talking. But once in a while, I do like to poke my nose to maybe where it doesn't belong. Or in this case, I think I would like to remind the CDC of something. Take a look here. This is from the CDC director on January 22nd, and you will take note of something here. They posted, I don't know whether they're having a function or just a group that got together. Take a look at this picture. You'll notice something here in this picture. All but one people are masked. There's the one person right there. See that? Just one person masked. Is the CDC forgetting what happened just about a year ago? This is, pretty ridiculous. Are they not remembering that almost 200 people reported COVID-19 after attending a CDC conference a year ago? Let's take a look at that. Update on rapid assessment of SARS-CoV-2 transmission at 2023 EIS conference. And take a look at this. The CDC's 2023 Epidemic Intelligence Service Conference brought together approximately 1,800 in-person people with 400 virtual attendees. God bless those that attended virtual. You did the right thing. You want to be around 1,800 different people? No, you really don't. So of that, 181 respondents report testing positive for SARS-CoV-2. Of those who reported testing positive, 52% reported no known prior COVID-19 infection. 1,435 of the respondents reported at least one COVID-19 vaccine dose. 49, or 27%, of the respondents who tested positive received antiviral medications. 70% of the respondents reported not wearing a mask. The event coincided with a period of low COVID-19 community levels where masking is not recommended in CDC guidance. None were hospitalized. Again, it only takes one person to come in positive to a gathering of this size to create an entire outbreak, which happened here. Again, they were not wearing a mask. So they had an outbreak. Here they are gathered together, and yet again, they are still not wearing a mask. Just totally ridiculous. All right, moving on here. Let's take a look at something that we have not looked at in a very long time. I didn't know there was a page for this resurrected or still in existence, but here we are. I found it out through a tweet the other day. Hospital bed occupancy. Yes, the percent of inpatients and intensive care unit beds that are filled, 7-day average, overall, and by patients with COVID-19 or influenza. Preliminary data are shaded in gray. So take a look at this. Yes, it's still being tracked. Thank goodness. I'm glad it is, because this is something I really liked looking at back in the early days of my pandemic update, and we can still do this on a weekly basis. All right, taking a look at the United States. Nationally, 78.8% of all beds in the United States are currently used. 4.1% are for COVID, 1.8% are for influenza. That's a lot of beds in use. So let's just randomly take a look at a few states. Let's go up to New England first. What's going on in the Northeast? How about Connecticut? Connecticut's currently at 75.7% of all beds in use. COVID-19 makes up 4.9% of those. And influenza is at 1.6%. Let's also take a look at Washington, D.C. What's going on there? Wow, yikes, not good. All patients, 82.5% of all beds are currently in use. 4.2% for COVID, 1.8% for influenza, and I meant to do this on the national level, and for Connecticut, but we can also take a look at ICU beds in use, and 70.8% of ICU beds are in use. 3.1% are for COVID, 2.6% are for influenza. Let's go back to inpatient. What is going on in the state of New York? Now, mind you, I haven't looked at every state. We're not going to look at every state right now, but we're just randomly looking at some states. And here's New York. Yikes, not good. 82.4% of all beds are currently in use. COVID is at 6.7% of the usage, and 1.7% is influenza. Now, you may recall, this is just coming to mind to me right now, when we used to do these pandemic updates back in the early days, I believe it was Rhode Island. Rhode Island was constantly really bad. And look at this, over the last several years. Yeah, wow, Rhode Island. But look at recently, right now. 91.8% of all hospital beds are currently being used in Rhode Island. That's not good. Rhode Island constantly has a hospital capacity issue, as does Metro Boston area up in Massachusetts. Look at Rhode Island. 91.8% of all beds are currently being used. COVID-19, 5.4% of them. Influenza is at 3.4%. That's not good. You have a capacity, and while we're at it, yes, let's also take a look at Massachusetts. And Massachusetts is currently at 88.2%. That's bad. COVID-19 is at 4.8%. Influenza is 2.1%. ICU usage. How about that? What's going on with the ICU usage in Massachusetts? 85.1%, 4.6% of that is COVID, 3.2% is for influenza. We have to go back to Rhode Island. I forgot to look at ICU usage for that. Yeah, 88.1%, with 3.1% being COVID, 2.9% being influenza. But let's look at other parts of the country as well. We can go down south. Florida, I'm really interested. What's going on in Florida? 76.5% of ICU usage is capacity of your ICUs are in use. And how about for regular beds? Yeah, 81.1%. 3.1% of that is because of COVID. 1.6% is because of influenza. Let's go out to California. What's going on there? California also at 80.1%. Anytime you're getting over 80%, that's quite a bit of usage, but as you have seen, there are some that are close to or over 90%. Not good. So California is at 80.1%. COVID-19 is at 4.3%. Influenza is making up about 1.5% of the usage. And how about ICU? What percentage of the ICU capacity is in use? 70.6%. That's not terrible. It could be worse. COVID-19, 3.4%. Influenza makes up 1.5% of that. And let's stick with the West Coast for a moment. Let's see what's going on in Washington State. ICU beds in use is currently at 81.9%. That's not good. How about actual inpatient beds? And yeah, it's starting to rise again. Look at that. It did dip down to 80.8%. Now it's up to 84.9%. And curiosity's got the better of me. Let's take a look at Oklahoma. Oklahoma is known for, they're the leading state for long COVID. Let's see what's going on there. 72.9% of capacity is in use. 3.8% is for COVID-19 and 1.4% is for influenza. Let's also take a look at ICU usage. And there your ICU usage is at 79.3%. Yikes, almost at 80%. 5% of that is for COVID, and 1.8% is for influenza. We'll take a look at a few more of these states again tomorrow, although real quickly, taking a look at the national level for the ICU usage, that is at 74.7%. We're going to look at some more of these states tomorrow because this is something that is very important to take a look at. All right, moving on now. This is actually some good news. I mentioned this on my climate update today as well. Montana secures $610,000 grant to improve wildfire, but that's just part of a larger effort. It says the U.S. Environmental Protection Agency is expected to award $10.67 million to enhance wildfire smoke preparedness to 9 recipients across the country. Remember, wildfire smoke, it was a real big issue last year. It really, in the Northeast, the northern states, there were wildfires up in Canada. There were wildfires on the West Coast. It impacts our lungs, our breathing, air quality. It's not a good thing. Let's take a look at air quality. And you're going to see it's not the greatest for today because there's just a lot of weather systems that are ongoing right now. You can see the mid-Atlantic. It's really foggy here. We're in dense fog. Anytime that happens, it can impact your breathing. Mine's not terrible, although the last hour I'm starting to get congested a little bit. It's just a normal symptom that I will probably never be able to shake off, even with my Exolar treatments. It just randomly happens. But the good news is it's better than what it was before I started this treatment, and my pulmonologist is happy with my lungs. West Coast, not too bad. Great Lakes, also. It's not terrible, but really the worst part today is it's the Mid-Atlantic region. I haven't said that in a while. If you want to learn more about climate, I do have a channel that I dedicated just to climate. And you can see right here, here it is, Climate Data Report. As I refresh this, you can see I did start or post a new video today. We're talking about the potential for a significant coastal storm in the Mid-Atlantic region. If you want to learn about that, go to my climate channel. I'll have a little card or something down here where you'll be able to click on to the channel. All right, let's move on now. We don't really want to take a look at wastewater today. We do want to take a look at the latest numbers from Walgreens. Let's let this refresh. And what you will see is testing is down right now. And because of testing being down, it's causing the national positivity to go up. The national positivity is now 28.7%. The prior week is 27.5%. That's a difference of up 1.2%. Total tests, 22,320. Prior week was 29,543. And you can see on this map, there's drops ongoing in the Northeast. There's rises in other places. But again, the places you're seeing rising, it's mainly not because of rising COVID cases, but because of decreasing amount of testing. Cases are really starting to drop in most areas, although there are a few random areas, with some being major cities, where we're noticing wastewater rise again. That's something we're going to have to continue following, even though the national trend right now for everything except for deaths is finally starting to drop. Let's take a look at some CDC data real quickly, and we can take a look at the variant tracker. JN.1 is the dominating variant by far at 85.7%. And yes, I can finally give you an update on EMS call volume in Philadelphia. I don't know if the person that updates this was sick, maybe they were on vacation, I don't know what happened, but we finally have an update on it. 760 EMS calls on Tuesday. That's below that really high 800 level. Anytime it's over 800, I'm not happy and I'm concerned. 760, we'll take it. What would be even better is to get a day below 700. We haven't seen that in quite some time. Let's do a live look in at the suburbs at what's going on here. And you can see, yes, there is some call volume. And yes, there are calls to be had. I do want to take a look at one thing. Though be it, right now, it is 5:30. We're a little late with our update today. There's something that concerns me that's going to lead to higher transmission. And I normally wouldn't show this, but you're probably going to think, how does this correlate? It does. Things are back to 2019 in my local area, and I think you can say it in your area as well. I just want to show you what the roadways look like around here. The roadways are absolutely mobbed. It's Wednesday. It's the biggest in-person office day of the week. I noticed it when I was out at lunchtime, and these roadways are absolutely mobbed. Take a look. This is a 3-lane each direction road. It used to be 2 lanes just not long ago. It's bumper to bumper going westbound with people leaving the offices. Malvern, Pennsylvania, there's more than 50,000 people that work in the offices. That hasn't been filled since pre-COVID. It's back to pre-COVID levels. I mean, look at these roadways. They're just absolutely mobbed. The point I'm trying to get at here is office transmission. Here's Pennsylvania Turnpike. What I'm trying to get at here is office transmission is going to be going up. While the national levels of COVID is down, we're going to be seeing more outbreaks in offices because people are back in the offices. I mean, I'm showing you these roadways. Oh, look at this. This looks really bad. There you go. These roadways are busier than they have been since 2019 at rush hour because people are back to the office. And a lot of people that I just showed you on that one roadway, Pennsylvania Turnpike, a lot of people commute from Malvern, Pennsylvania over into New Jersey. So it's a state-to-state thing. Who remembers in the early days of the pandemic where you really couldn't go state to state? You had to quarantine for 14 days, or was it 7 days, if you were going to leave from one state to another state? Yeah, well, you don't have to do that right now. So back to in-person you go for those people that commute 30, 40, even 50-mile commutes. There's some people that have long commutes. That's just my area. I'm sure it's the same thing in your area. Let me know. Are you seeing more cars in the parking lots of businesses and offices? Meaning less people are working from home? I'm certainly seeing it, and it's concerning. It's going to lead towards more transmission, and obviously that means business travel at the airports is going to be back as well. All right, taking a look at what is going on in the state of New Jersey, we'll take a look at today's hospitalization numbers. 69 out of 70 hospitals reporting. What we are not seeing is an increase in hospitalizations. New Jersey hospitalizations continue to drop, 1,086. Number of people on a ventilator is at 47. Again, all but one hospital did not report today, so it's really 69 out of 70. That's a good thing. I would like to see 70 out of 70 though. Patients in the ICU, 137. Discharges, 157 people discharged. So yes, people are being discharged. That's a good thing, and I think we're going to see New Jersey drop below 1,000 this week. I don't think the office transmission is going to cause a large increase, but I think it's going to be something that, hey, be aware of. If you work in an office, go wear a mask to work. There's someone who posts on Twitter a fantastic Twitter account. It's called The Lone Masker. She works in an office. She masks there every day. If you work in an office and you're being forced back to the office, you need to start masking again because it's an easy way, especially these places that have 200-300 people in these rooms with office cubicles. It's an easy way to catch COVID. Or maybe you're having an office lunch. I delivered to somewhere today. They were having a big lunch party. I don't know. It was a very large order, and you have to wonder. I mean, it's going to be maskless. How many people are going to be there? I don't know. But anywho, New York State, 2,268 cases, and their hospitalizations continue to drop. They're now down to 2,573. All right, real quickly, Texas. There's going to be some changes with the way Texas reports. Looks like their reports are going to be every Friday now. I'm looking to find a dashboard. I clicked on where it says dashboard, which then leads me to this. I'm not seeing anything yet, so I'll let you know if I do find anything about this. And of course, it's supposed to be on Friday, so if we do see something on Friday, we will let you know about it. That's all I got for today. All the other states I'm looking at on my browser for pandemic update here. Have not updated. I've refreshed them all, and I'm not seeing anything on them. Of course, we will hopefully get something from them tomorrow. That's it for today's pandemic update. If you learned anything, give this a thumbs up. If you like what you see here, subscribe down below. I will see you guys all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Wednesday evening. Thanks for watching.